anger over a face covering. How did this simple piece of cloth become so political, especially in the United States? On today's show, then, we're looking behind the mask. More and more governments are asking, or sometimes obliging, their people to wear one in public. They say they're simply following the overwhelming scientific advice which states that masks do help to reduce the spread of the coronavirus significantly. Some people don't trust this advice. They say the guidance on masks, for example, from the World Health Organization, has been contradictory and erratic. Anyway, mask may carry its own risks, they say, and is uncomfortable. Some say it contravenes their rights as citizens to make a choice. Others suspect the mask, like the earlier lockdowns, is simply part of an attempt to make people afraid and unhappy with the Trump administration. In a moment, we'll hear from a Trump supporter who thinks the mask is a complete waste of time. And we'll hear from a doctor who thinks she is spouting dangerous nonsense. But first, a quick reminder of how we got here.
Do these masks really slow the spread of COVID? It seems like 5 minutes ago we were told they weren't necessary at all, and now they're as commonplace as sweatpants.
We know scientifically that masks are proven to prevent infection from one person who is sick to another.
We now have excellent scientific evidence of how far droplets go when we speak or just simply talking to one another.
So masks are vital to stopping the spread. But even though Florida is one of the hot spots in America, Palm Beach residents were enraged about a vote to make wearing a mask mandatory.
What you say is the political dogma that they're trying to shove down our throats.
Somehow wearing a mask has become this political flashpoint.
Are you going to allow the government to tell you you have to wear a mask?
I can't breathe.
Insanity. Some people say they restrict my personal rights, but really they represent freedom, because if you wear a mask, people are going to be able to keep their businesses open.
Anyone harassing me to wear a mask, you guys are violating federal law. You get that? Get that on camera.
To wear or not to wear one of these has in many quarters become a matter not just of health and safety, but a matter of who do you believe?
I don't know. Somehow, I don't see it for myself.
The president finally agrees to be seen in public wearing a mask, and it came during a visit to the Walter Reed Military Hospital here in Washington earlier today.
It's gotten bad enough that even Donald Trump finally decided to wear a mask in public.
Will you consider a national mandate that people need to wear masks?
No, I want people to have a certain freedom, and I don't believe in that, no.
Every single American should be wearing a mask when they're outside. It's not about your rights, it's about your responsibilities.
Well, let's bring in our first guest now, and Suzzanne Monk is a vocal Trump supporter and founder of Reopen America, strongly against mandatory mask wearing. Thanks, Suzzanne, for joining us. I really appreciate it.
Thanks for having me.
I imagine you're the sort of person the media wheel out in order to bash up, yeah? Because you're against the medical orthodoxy. You're saying that masks aren't necessary and that America should be reopened as quickly as possible.
I've been saying America should have stayed open from the beginning. As we saw in Sweden, there was certainly a lot of damage done by the shutdown itself that wasn't necessary. And so I've been saying that from day one.
Very high death rate in Sweden.
Well, if you look at the numbers, actually, they did have a slightly higher death rate. They had a lower than usual contagion rate, but their death rate was actually well within other European nations that did shut down. So,
and the highest death rate in the world.
A little bit on whether or not shutting down helped or not.
And for the United States, the highest, if not one of the highest death rates per capita in the world.
New York has obviously been a hotspot, and you can certainly expect that. We've had a lot of concerns about testing here. In fact, 77 NFL players were actually tested, and those tests came back positive the first time. They were retested, and they came back negative. So we're a little concerned about the effectiveness of testing and what the results are actually showing.
Why wouldn't you support masks if they even have any chance of working whatsoever? And according to some doctors we've been talking to, some, I'm not saying all, they have every chance of preventing the person who's wearing it from spreading it to someone else?
Well, it's very interesting you say that, because the research that I've been doing on the effectiveness of masks actually suggests that cloth masks are very ineffective in preventing any transmission, both from the wearer or the others in the environment. But even in surgical situations, there's a great deal of studies, including out of the Karolinska Institute in Sweden, the British Medical Journal there overseas, that have done experiments in the operating room with masks not being present, even on the surgeon, and they have found no difference in rates of infection in that surgical setting. So
Dr.
the
Fauci,
science is not settled on masks at all.
Dr. Fauci's wrong, the WHO is wrong, and well, even the President of the United States now can be seen wearing one from time to time.
Well, which Fauci is wrong? Because certainly Dr. Fauci, up until April, as many of the experts in the field, recommended not wearing masks,
Right.
not universal mask use for the public. And so we'd like to know what changed science-wise to now suggest we need a mask mandate 4 months into a pandemic.
Well, the doctors tell us what changed science-wise is that back in April, they weren't clear that asymptomatic people could spread it, and now they are.
Well, the World Health Organization is actually clear that that is extremely rare. That is the message from the World Health Organization themselves. So this is another area where we're very concerned that the science we're getting is half-baked or half-processed, and it changes from week to week. So we have great concern that that's any kind of science at all if it's not just politically motivated.
Actually, why has it become political then? Because if someone like Joe Biden says, you know, it's not about politics, it's about responsibility, and there's really no downside to wearing one, why not just follow the advice to wear one?
Well, I disagree that there's no downside to wearing one. Before we even began the many potential health problems, certainly what we're seeing is a lot of economic destruction and continued fear of the public to be in restaurants, in events, in locations, because we have our experts constantly telling us, cover your face, don't breathe other people's air, you might die. So there are other consequences to universal mask use above and beyond the medical reasons, and no one is actually looking at those impacts of those effects, including the psychological effects on our children wearing masks.
Now, some people, they would be deemed by many to be conspiracy theorists. I'm not going to give their name, but they have been widely quoted on the internet as saying that the mask is simply a way to make people afraid, to make them desire change, to get rid of Donald Trump, and also possibly a precursor to forced vaccinations. Is that something you subscribe to?
Well, I think that some of those fears come from the experts themselves, from folks like Ralph Northam, the governor of Virginia, who is already suggesting a mask mandate a vaccine mandate in his state. So that's where those fears are coming from. We see governmental leaders telling us to wear a mask until we can get the vaccine. So we're not making up that fear. That fear is actually coming from our leaders itself.
How far would you go, and how far would you suggest supporters of President Trump go if in their state they are told it is mandatory? Shouldn't they just stay at home if they don't want to wear the mask? Or are you saying they should go out and perhaps demonstrate civil disobedience?
I believe in civil disobedience. I also believe in engaging the legal process. So if you have a mask mandate in your state, go ahead and get that ticket. And I can personally help you find an attorney who will help you take that case up through court. It is not legal what they are doing, mandating a medical procedure on a citizenry.
And final question, if doctors say that you are, in your civil disobedience, putting other people's lives at risk, you would say what?
Show me the science, because I haven't seen it yet.
Well, I think there are many doctors who would say they have copious amounts of data to show you. Suzzanne Monk, thank you so much for your contributions to The Nexus. Well, whether you agree with Suzzanne or not, one thing is clear: the advice from top health officials on mask wearing has been inconsistent over the past few months. Back in February, the WHO published this video advising people to only wear masks if they had symptoms.
If you have cough, fever, and difficulty breathing, you should wear a mask and seek medical care. If you do not have these symptoms, you do not have to wear masks. because there is no evidence that they protect people who are not sick.
But a couple of months later in June, they changed their advice, recommending a much wider use of masks.
In light of evolving evidence, WHO advises that governments should encourage the general public to wear masks where there is widespread transmission and physical distancing is difficult.
And one of the leading members of the coronavirus task force in the United States, Dr. Anthony Fauci, has also sent mixed messages about wearing masks over the past couple of months.
Right now in the United States, people should not be walking around with masks.
One of the important things that we're emphasizing right now that really evolved from a situation that did change is our insistence now on wearing masks. I mean, masks are very important. They protect you from giving infection to someone else.
Okay, let's bring in the first of our two doctors we're talking to today. Dr. David Agus is a Beverly Hills-based physician. He says it's really quite simple. Wear a mask. Dr. Agus, thanks so much for joining us. Let's just start with this evolving advice that we've had from the WHO, from Dr. Fauci and others. At first, they were saying there's no need to wear a mask, and now they are quite insistent that it is important to wear one. Can you tell us how that evolved over time?
I understand it's very difficult. That science is being played out in the public, and we are learning as we go. And that makes it very difficult for the media and the general public to understand what's happening. But very clearly, in the beginning, we did not know with this virus that there was asymptomatic and what we call pre-symptomatic spread. Pre-symptomatic is you are contagious several days before you're symptomatic if you get symptomatic with this virus. And so what we know now is that the virus is droplet spread, and asymptomatic individuals can spread it with droplets. Before we had said, if you're sick, stay home, and we thought that would actually stop the virus. Now we know differently, and wearing a mask definitively can stop spread of the virus. And we have to wear masks if we want to take control and get our lives back.
Right. And yet even the layman at home would be watching and thinking, well, of course, if you wear some sort of barrier between you sneezing and coughing, it is going to help those around you. And that is true of previous viruses and colds. So how comes it took several months for the advice to change?
Well, this virus is different than every other virus we've had in that when you're asymptomatic, you can spread it through droplets. So every time you breathe, 40, 50, 100 droplets come out with virus. And if there are enough of them, they can spread it to a person near you. You need prolonged close interactions. So if you have a mask on, you will block those droplets and there won't be spread of the virus. Put it this way, if there are 10 people at a dinner party and one person has it, and this is an indoor with no ventilation, only the 2 people on either side of the person with the virus will catch the virus. If you wear a mask, none of them would.
And of course, if you had the common cold or a virus predating this one, you're saying those are not contagious before you become symptomatic. Is that right?
Exactly. It's not contagious before you become symptomatic. And everybody who gets that virus, everyone who got the flu would be symptomatic. And they would know they could spread. They would stay home and not go to work or go out to the pub.
Do you regret maybe perhaps that the advice wasn't to wear a mask in any case? Because obviously there's always a moment in time, isn't there, when you're perfectly fine, you're sitting on a train home, and half an hour later you have your first sneeze or first cough and you realize that you do have something and now you're symptomatic.
Right. You have to realize early on, right, we had a dramatic shortage of PPE around the world. There weren't enough masks to go around. And the frontline healthcare workers didn't have enough masks in many of the hospitals around the country. So the mantra was, let's save the masks for the people at the front line who are putting their lives at stake by helping other people. And then as we had more PPE and as we learned about asymptomatic spread, the rules changed. And when rules change, it makes it very difficult. But the data are clear. In the beginning, the mantra was incorrect. Now we know what to do.
Was there ever a time where people knew, the scientists knew what to do, but because they feared PPE shortages, they kept that advice to themselves until the PPE was there to meet demand?
No, because what we know now is that cloth masks can block droplets very, very effectively. So the initial PPE issue was with N95 masks or masks that actually protect you as an individual. Remember, what an N95 mask can do is protect you from getting virus from others. Cloth masks protect you from spreading to other people. And that's critical. The role of the mask is to protect others. So if everyone doesn't wear a mask, we're not protected. If everyone does wear a mask, we are. In our country, we have people standing up saying, I am not going to wear a mask. It is my right.
Yes.
Well, it is not your right to harm others. And that's what's critical.
Now, you mentioned cloth masks. Our guest earlier in the show, who was a President Donald Trump supporter, sent me a British Medical Journal study which says that a randomized controlled clinical trial of cloth masks found that the wearers had higher rates of infection and the filtration was poor compared to surgical masks. Is that still true? And should we aim to get a better mask if it's possible, if it's available to us?
Well, remember, that study is backwards because it's showing that about catching the virus, wearing surgical masks or an N95 mask can protect you better than cloth masks from catching the virus.
Right.
But the way we are doing things now is the opposite, is everyone is wearing a mask so they don't spread the virus. And they are very effective at blocking spread of the virus. That's incontrovertible. So people can twist things many times, but the data are clear. If we all wore a mask, we respected others, we would stop spread of the virus and we wouldn't harm others through our interactions. You know, that young person who's asymptomatic, they don't mean to harm somebody, but when they go out without a mask, they can cause significant harm. And we're seeing that. There was one person at a conference in Boston for Alzheimer's, and they were asymptomatic, didn't know they had the virus, and 20,000 people were infected over time from that individual. The data came out today.
Yeah. Now, you mentioned that it become political and people thought it was a question of rights. Can I ask, it's not perhaps typical around the world. You do see it in spits and spots in different countries, Europe even, but very strongly in the United States. Why is that?
We're the only country I know of with a Bill of Rights. There's a notion that everyone has an individual to do what they want. And now, when many people, we've taken away their jobs, we've taken away their income, this is their way of stepping up. At the same time, we have a president that initially did not support West. Now he does, but he initially did not. So it almost became a political statement, an individual rights statement, I think without understanding that they were harming others. I don't believe they meant to cause harm, but unfortunately they did.
Well, early on, of course, he was saying it's not that I'm saying you shouldn't wear one. I'm not prepared to wear one in the Oval Office. And of course, it was in the early days when others were saying, you know, maybe it wasn't necessary. He has moved with the times. Let me ask you about another political aspect. We're told that if you can all wear masks, then everyone will be safe. And if it's not happening, for example, during the protests, then there is a danger. Is that right? Even people protesting should consider the health benefits, the public health risks. Is that right?
No question about it. Is that everybody needs to think of others. And when you're protesting for rights, you have to think, listen, I care about others. And what does it look if I'm protesting for my rights, yet I don't care about others by not wearing a mask? Sure. So I think there's a new era, and the era is we are one community, and we have to look at the data. In areas of the country, in the United States, where they mandate wearing a mask and they fine you if you don't, the rate of virus spread plummets and goes down dramatically. In areas where it's optional, the virus spread continues.
Oh, well,
the data are clear in many different countries.
Here's my question, then final question. If everyone, I just want to confirm, if everyone is wearing a mask, then it is safe for everyone to come out of hiding, out of lockdown, if you like, and associate.
No question about it. They still need to do some distancing because, you know, we want to stop 100% the spread of the virus. You couple the two together and you can do that. You know, in the beginning, we all knew what to do. We stayed at home. We understood that. Now, in the second stage, where some people are saying, well, you don't have to wear a mask, and others are saying you do, where there's that indecision, many people don't know what to do. What we need is one standard. We need leadership to step up, driven by the data, to tell people what to do, to protect others, to protect our economy, to protect our schools and our children.
So presumably, come November then, if everyone is wearing a mask, you'd have no problem with everyone going in person to vote, no need for mail-in voting.
Correct. I mean, you have to think like that. You know, what people don't understand about this virus is that if you're asymptomatic, there's still significant inflammation in your lung, and there may be long-term ramifications. So there may be an entire generation of people who had the virus, and they weren't problematic while they had the virus, but later in life, they have other medical issues. We have to step up for the health of the nation, our country, your country, every country.
Well, Dr. Agus, thank you so much for joining us. Appreciate your contribution to the Nexus. Well, let's bring in our second doctor now, Dr. Alieta. She is a member of the American Association of Physicians who thinks masks are really not necessary as the pandemic has pretty much fizzled out. Dr. Eck, I don't know if you were able to hear any of what Dr. Agus was saying, but he was saying that the science is very clear, masks are 100% necessary, and then America can resume normality.
If there's one thing I've learned in this pandemic is that nobody knows everything, and there's a lot we still need to learn. So when people make very strong statements, you have to look back and say, well, was that really true? I remember the strong statements back with the Attorney General of the United States said that masks are unnecessary. That was back in March. And, well, maybe they were necessary for a while. I guess we don't know. We have to look back. One thing I found out, Denmark has the lowest COVID death rates as of August 4th, 616. And 1/3 of the number who die from pneumonia or the flu have died of COVID. And the Danes do not wear masks. So if we look back at the different countries where they've done different things, maybe we can learn something. I don't think all the evidence is out, and I think that our Attorney General and our Surgeon General has said that masks actually could harm people. So maybe we need to look at that data too. And not
in what way could they harm people?
Just that as a virus, if you're just breathing your own air and you're bringing more CO2, it makes you a little bit sedated. And some people who have chronic obstructive pulmonary disease could be harmed by rebreathing their own air. So it could harm them.
I suppose someone like Dr. Agus would say, well, there's no data for that, number one, in his opinion. And secondly, even if there is, they're in such a minority, it still doesn't make it an invalid suggestion or rule even to make everyone wear a mask.
I think what's happened is it has become a very frightening scenario. And there are some people who are just terrified. So if you walk into a room and don't have a mask on, there are people who will look at you like you want to kill me. There's just very, very frightened people out there. So out of respect to their fears, I'll wear a mask. If I go into a grocery store, I'll wear a mask. Some of them will mandate it, some won't. When I'm outdoors, when I'm in a park, I will not wear a mask. I just don't think it's necessary outdoors. I just don't think that we have enough data to say that that is the reason that we have really licked this virus. Yeah. We just don't know.
I have heard Americans saying that they are sick of being stigmatized if they don't want to wear the mask. They feel it's a matter of their own right to do so. And that politicians like Andrew Cuomo have made a very nasty atmosphere in the country when he says it's disrespectful for people to refuse to wear a mask in public. Quotes, you can literally kill someone because you did not want to wear a mask. How cruel and irresponsible would that be? Is it statements like that that have made it political, that have somewhat brought some division amongst people, ordinary people?
Yeah, it's extraordinarily inflammatory to say something like that. Because I don't think the data is really that clear that masks are the reason why this virus is slowing down. I think it is petering out. I think in my state of New Jersey, we had 3 deaths in the last week. We've had more deaths from many, many other things in the last week, and yet those are not making us, they're not driving everything that we do. We still don't have any gyms open. We still don't allow inside dining for restaurants. Even though there are precautions they're taking all over the country where in-dining restaurants are okay. And I just don't think it's very clear that all of these restrictions are necessary.
Now, it's interesting because a lot of people who are against the mask feel it is somehow anti-Trump. But we just heard from Dr. Agus that if the mask is worn by everyone, then there will be no need for mail-in voting, which I know that President Trump is very concerned about, and everyone can go and vote in person. Isn't that something that works in President Trump's favor then, to promote the mask in the absence of a reliable vaccine or really good treatments? Perhaps he should embrace the mask and say, right, okay, everyone should wear the mask, come out on November the 3rd, is it, and vote.
Absolutely. I think that would be a very smart political move for him to make make people wear masks if they go indoors. If they're going into a polling place, they're going to be close to people. You have to wear a mask, and then you'll vote. And I think that that would be fine. The whole issue of the mail-in votes, the worry is that all of these millions of ballots are just going to go out to every single registered voter, whether they're dead or alive or whether they've moved away. There's going to be a lot of ballots floating out there, and that's what he's concerned about, that could be a very opportunity for fraud.
Dr. Alieta Eck, thank you so much for your contribution to the Nexus today. And thank you at home, of course, for watching. Remember, you can see this episode and all our previous episodes on our channel on YouTube. Just type in Nexus TRT World. Until next week, then, goodbye.